Contact lenses continue to be an important part of our practices. As such, a discussion of the ocular surface that supports lens wear is critical. Our patients' environments are challenging. As can be seen here, contact lens surface drying is an unfortunate byproduct for many lens wearers. It's not surprising that when those patients who've discontinued lens wear are questioned, over 50% of them report doing so because of comfort issues. And although there are a number of factors that can affect comfortable lens wear, we'll focus on the role of ocular surface wellness in optimizing the lens wearing experience. We recommend putting a system in place to determine a patient's subjective symptoms and also assessing the surface of the eye in great detail in hopes to gather information that will be helpful when fitting patients with contact lenses. One of the first steps is to gather an adequate history of ocular dryness. Two examples shown here are the SPEED questionnaire and the Ocular Surface Disease Index, or OSDI. Although many current contact lens wearers may report that their lenses are comfortable, sometimes this doesn't tell the whole story regarding their true wearing experience. In our attempts to more accurately understand a patient's wearing experience, we ask them to grade their comfort on a scale from 0 to 10 at the beginning and end of the day, with 0 being the least comfortable and 10 being the most comfortable. What we oftentimes expose is a significant drop in comfort towards the end of the day, and certainly something that needs to be addressed in order to mitigate the chance of patients silently dropping out of lens wear. Just as important as the subjective questionnaire is also the anterior segment examination. It's critical to identify patients with any anterior blepharitis as seen on the left. Additionally, viewing the lid margin is critical. The video on the right shows a serrated lid margin, which is typical for those with meibomian gland dysfunction. Also, when pressure is placed on the outside of the lid, no meibum can be expressed. But there are a number of things that are just simply not visible with a standard slit lamp examination that should be considered when assessing ocular surface wellness. The use of lissamine green and fluorescein allows a greater appreciation of the quality of the ocular surface. The lid wiper is a portion of the marginal conjunctiva of the upper eyelid that acts as a wiping surface to spread the tear film over the ocular surface, or in contact lens wearers, the surface of the contact lens. Lid wiper epitheliopathy is simply staining of the lid wiper and is associated with symptoms of dryness. Viewing conjunctival and corneal staining with lissamine green is also a sign of ocular surface compromise. If present, fluorescein also allows us to see punctate epitheliopathy. Additionally, because of the hydrophilic nature of the molecule, it allows for the visualization of the tear film. Normal tear film breakup time is expected to be greater than 10 seconds. As you can see in this patient, it's severely reduced. Fluorescein also makes the tear meniscus easily visible so that its viability can be assessed, as seen in the bottom right video. Additional diagnostics are also available to help in screening those that may have ocular surface disease. Tear Lab measures tear osmolarity and is useful to help identify those with undiagnosed dry eye. The inflammadry, seen on the right, measures whether the tear film contains matrix metalloproteinases that are at a higher concentration than 41 nanograms per milliliter, another common sign in dry eye patients. Assessing your contact lens wearers for ocular surface disease is critical for the successful contact lens practice. Incorporate a history that standardizes the questions that are being asked. Additionally, consider utilizing the vital dyes along with advanced technologies to help in identifying those whose ocular surface may be compromised and needs attention. We feel that this will improve visual and ocular health outcomes for our contact lens wearers, which is ultimately why we do what we do. We hope that this has been clinically insightful.